Increasing diversity of the U.S. population. Minorities are projected to become the majority. Ethnic minorities are affected more often by healthcare disparities and inequalities. Cultural competence is necessary for healthcare professionals to provide care for a diverse population and can help improve health outcomes and quality of care. Family members and friends should not be asked to be an interpreter for the client because of confidentiality, the potential for conflict of interest, and the risk associated with relaying inaccurate information. Only those individuals designated by the healthcare agency should be asked to interpret for a client. Return demonstration and explanation or teach back are of particular importance when working with clients of various backgrounds to ensure safety and mutual understanding. Some ethnic minorities report hesitancy in seeking health care due to a language barrier. Ineffective communication between the healthcare provider and the client can affect client safety or the client's ability to comply with follow-up care. Racial and ethnic minorities. Number 1, African Americans or blacks. This population has origins in Africa and the Caribbean. Most of them may be less likely to have health insurance coverage or a regular source of health care. Most adults have chronic health conditions. Obesity, diabetes mellitus, hypertension, heart disease, asthma, and cancer are prevalent among this population. Some leading causes of death are heart disease, cancer, and stroke. Second minority, Hispanics or Latinos. They came from Mexico, Puerto Rico, Cuba, South or Central America, or other Spanish culture or origin. Some in this population may not have health insurance coverage or a regular source of health care. Language barriers and lack of access to preventative care influence health. Most adults have chronic health conditions. They lack routine health care and delays seeking health care for illness are common. Obesity, diabetes mellitus, end-stage renal disease secondary to diabetes, and cervical cancer are prevalent among this population. Some leading causes of death among this population are heart disease, cancer, and accidents. So when you educate them, the important health topics to include, but are not limited to discussions surrounding diet and meal planning, exercise, and safe sex practices. Third, Native Hawaiian or other Pacific Islander. They've originated from the Pacific Islands, including Polynesia, Micronesia, and Melanesia. They were noted to have higher rates of smoking, alcohol consumption, obesity, and diabetes mellitus. Some leading causes of their death are cancer, heart disease, accidents, stroke, and diabetes. There is a higher incidence of infant mortality and sudden infant death syndrome. Prevalent among this population are hepatitis B, human immunodeficiency virus, and acquired immunodeficiency syndrome, and TB, or tuberculosis. Fourth, American Indians and Alaska Natives. They came from North, Central, and South America and have tribal or community attachment. Some of them may not have health insurance coverage or a regular source of health care. Cultural barriers, geographic isolation, and low income prevent this population from receiving quality health care. Smoking is a common practice. They were noted to have higher incidence of diabetes mellitus and stroke. Some of their leading cause of death are heart disease, cancer, malignant neoplasm, cerebrovascular disease, and accidents. They have higher risk for altered mental health, suicide, sudden infant death syndrome, teenage pregnancy, liver disease, and hepatitis. Also high incidence of infant mortality. Last are the Asian Americans. This population has origins in Eastern Eurasia, Southeast Asia, or the Indian subcontinent. They were noted to have different types of cancer, tuberculosis, and hepatitis. Some leading causes of death among this population are cancer, heart disease, and stroke. Some older Asian American women are at an increased risk for suicide. Healthcare considerations for racial and ethnic minorities. Cultural competence is a mainstay in the effort to reduce racial and ethnic healthcare disparity. The nurse and other healthcare professionals should be trained in healthcare variations and risk factors for various populations in order to facilitate access to needed healthcare services. It is very important for the nurse to examine his or her own cultural preferences in order to competently care for someone of differing culture. Emotional intelligence is a useful tool in caring for the special populations. Knowledge of the various racial and ethnic groups in terms of cultural preferences, health risk, and health preferences is needed to deliver culturally competent health care.